Today I'd like to introduce you to Felicity Stockwell, who's going to talk about the importance of good communication in nursing care. Felicity, your research on the Unpopular Patient was recently voted the most influential piece of nursing research. Did that make you feel proud?
Well, it should have made me really proud, but in point of fact it didn't. When somebody came up to tell me that, the result, my heart sank and I felt really disappointed. When I did the study, I wanted people to gain from it some understanding about maternal-infant bonding. But since then, much later since then, I discovered that people don't bother to read the theory at the back. I think sad to say that nurses haven't taken on board anything about the maternal-infant bonding.
And why is that important that they do?
Because understanding people's emotional needs and all the factors that make humans sociable is at the core of the nurse's task in caring for patients. I do believe that my research is as relevant as it ever was, and if it could be, it's even more relevant now, because as I look around there are increasingly reports about lowering standards of nursing care. And being an elderly person who lives in a local community, I'm increasingly hearing people who've had pretty horrendous accounts of being looked after in hospital these days. And it makes me and my companions really scared of needing to go into hospital.
Can you explain the significance of maternal-infant bonding?
When the mother is nurturing the baby, she's setting up a whole lot of sensations that feed into the baby's brain and get remembered and can be established as needs that they need for the rest of their life. Now these needs we usually call needs for acceptance and needs for approval. But it means we need to be liked and loved. And in order to get these needs met, we have to learn what we've got to give in order to get. When needs are met, then cholines are released and they go to special endorphin areas in the brain. And when needs are not met, then adrenaline is produced. With the physical needs not being met, adrenaline sets up an alerting system and causes physical changes in the body that everybody knows are the symptoms of anxiety, with a bit of palpitations and stomach upset. We are motivated to mix with other people, depend on other people, and give to other people for contentment. Now, when emotional needs are not met, and anybody has had some experience of this, if you're at a party and nobody takes any notice of you, you feel dreadful, and humans will run away and they won't stay there. But if you're a patient in a ward, you can't run away, they won't let you. So the anxiety that is felt when emotional needs are not met is exactly the same as when physical needs are not met. The big difference being that when physical emotional needs are met, when you're hungry and you've eaten, then the adrenaline absolutely goes back to its normal level and the anxiety goes away. But when emotional needs are not met, the anxiety doesn't go away because the memory circuits make you remember that humiliating moment or how lonely you are. It's present with you all the time. So the anxiety levels don't go down. if emotional needs remain unmet. And that's not a good place to be.